So let's talk about the brands of the hydrochlorothiazide. Well, there are three brands which I have been here. Number one is Xavor Dio. In Xavor Dio, hydrochlorothiazide is present along with an AC inhibitor that is losartan. On the second position, you will see a brand of the spiroside name. It contains spironolactone along with the hydrochlorothiazide. And the last one is a urozine. In urozine, you will see hydrochlorothiazide along. Well, there are three strengths available of hydrochlorothiazide: 12.5 milligram, 25 milligram, and 50 milligram. Now let's discuss the dosing regime for specific indications. Well, there are four different indications in which you can use hydrochlorothiazide. I have divided these four indications into two classes. In class 1, you will see those indications which are not linked with hypertension, and in class 2, you will see those indications in which there is link of the condition with heart failure. Well, in the class 1, you will see hypertension. So for the hypertension which is not linked with the heart failure, you have to give 12.5 to 25 milligram of the hydrochlorothiazide depending upon the condition for once a day. And then the second one is the edema, not linked with the heart failure. Then you have to give 25 milligram. You can go for the OD, means once a day, or BD, 2 times a day. Then comes the conditions which are linked with the heart failure. Well, hypertension linked with the heart failure, then you can give 25 milligram to 50 milligram 4 times a day or 2 times a day orally. Then if heart failure is followed by the edema, means mild fluid retention, then you can go for the 25 milligram 4 times a day or 2 times a day. What if overdose occur? Well, in overdose, you will see different conditions taking place in the patient's body. So to overcome those toxicities, we have two things to do. Number one, to reduce the effect of lost fluid, we have to build up enough fluid. So we will give normal saline to the patient. Number two, when the patient have got the reduced blood pressure, means hypotension, so for that purpose you have to give norepinephrine to the patient. There are two dosage forms available of the hydrochlorothiazide. Number one is the tablet and number two is the capsule. Now let's discuss about the pharmacology of the hydrochlorothiazide or other thiazide diuretics. Well, the pharmacology of this drug is really simple. You'll see behind me a nephron. In nephron, there are three parts: proximal convoluted tubules, loop of Henle, and distal convoluted tubules at the end. Then this nephron merges with the other in the form of collecting duct. So in the DCT, means distal convoluted tubules, you will see the sodium channels or the sodium carriers. Now what is actually the function of this sodium channel? Well, when the urine passes from the nephron tubule, from the lumen, the sodium channels actually pump the sodium out of the urine into the blood. So when the sodium gets back into the blood circulation, it means that sodium has been reabsorbed. Well, sodium reabsorption inside the body occurs with some other things as well. There will be the sodium reabsorption linked with the reabsorption of the water, potassium, and other ions like hydrogen ion as well. So what is actually the function of the hydrochlorothiazide and other thiazide diuretics? Well, it is very simple. If we block the sodium channels, sodium carrier present in the DCT, and what will happen? There will be no reabsorption of sodium whatsoever, leading to the decreased reabsorption or the no reabsorption of water and the potassium. There are some of the interactions linked with the diuretics. specifically thiazide diuretics. So there are a few drugs like NSAIDs, beta blockers, calcium supplements, and carbamazepine, cyclophosphamide. So these are some of the drugs which have shown contraindications or the interaction with thiazide diuretics. So you have to check before taking the thiazide diuretics whether the patient is taking medication from these listed medicines or not, and then you have to prescribe them. Now comes the side effects of the thiazide diuretics. Well, it includes hypotension, hypomagnesemia, hyperuricemia, arrhythmia, exfoliative dermatitis, and Steven-Johnson syndrome. At the end, we have to see the contraindications. Well, there are two contraindications. Number one is the pregnancy, and of the category C, there is the contraindication. And on the second position, we have the lactation. Well, in case of lactation, let me tell you one thing, that diuretics has been found in mother's milk, but no side effects has been shown. So it is better not to use thiazide diuretics if the patient is a nursing mother.